Today I will discuss about local anesthesia and regional anesthesia. First of all, what is local anesthesia? Local anesthesia is used in case of large animal. Generally, most of the surgical intervention has been done under this local anesthetics technique. Albeit majority of surgical intervention can be done by this using this local anesthetics, but general anesthesia is nowadays general anesthesia is also used by many institutions. Even in somewhere in field condition also people are using this general anesthetic technique, and there is different combination of drug used for this general anesthesia, but local anesthesia is very important. So local anesthesia produce desensitization and analgesia of a skin surface. If you are using local anesthetic to desensitize some mucous membrane, like you are going to apply topically over vaginal mucous membrane, you are going to apply for catheterization at the time of catheterization, which so topical anesthesia is used, and tissue infill. If you are going to desensitize or interested for analgesia of tissues, then infiltration and field block technique is used. And regional structure, if you are interested for a to block some region of the body, then that is also known as conduction anesthesia. Regional anesthesia is also known as conduction anesthesia. So first of all, I will discuss a little bit about this classification of local anesthesia, local anesthetics. Basically, local anesthetics classified on the basis of their structure activity relationship. These are classified into two groups, that is ester linked group drugs and amide linked group. So I am not going to discuss in detail about all these drugs. Already you have idea about these drugs. In pharmacology you have read. Then another classification of local anesthetic is based on the duration of action. Long acting, short acting, ultra short acting. Sundita.
Yes, sir.
एक असाइनमेंट मैं आपको दे रहा हूं, आप classification of local anesthetic on the basis of duration of action, ultra short acting, intermediate acting, long acting, ये सब आप नोट करके नेक्स्ट क्लास में मुझे बताएंगे. So under this ester linked groups, procaine, tetracaine, benzocaine, and under this amide linked drugs, which is most commonly used here for veterinary use, that is lidocaine hydrochloride. And these local anesthesia have minimum tissue damage or irritation. It should have no allergy or irritation. Mild sedative effects sometimes is noticed when it is given intravenously. That is known as anesthetic sparing effect. One term most commonly used in this anesthesia is dose sparing effect. Means, suppose what is dose sparing effect? नोट कर लीजिएगा आप लोग, लिखा नहीं है पीछे पहले. डोज स्पेयरिंग इफेक्ट. Dose sparing effect is decrease in the dose of main anesthetics by using different combination of this pre-anesthetics like xylazine. Suppose you are using atropine, xylazine, ketamine, or atropine, diazepam, ketamine, fentanyl, or butorphanol. If you are going to include combination of these pre-anesthetics to achieve balanced anesthesia, then what will happen? Whatever dose of main anesthetics like thiopental, propofol, which is used for induction of anesthesia, has been decreased. If you are adding these pre-anesthetics and muscle relaxant, analgesic drugs, anticholinergic drugs, then the main drugs which is responsible to produce general anesthesia, dose of that particular drug will be decreased. And this decrease is in dose is known as dose sparing effect. मतलब कितना डोज मेन एनेस्थेटिक्स का घटता है। अगर मान लीजिए आपने एनाल्जेसिक ड्रग भी दिया है, मासी रिलैक्सेंट भी दिया है, एंटीकोलिनर्जिक भी दिया है, एंड देन यू आर गोइंग टू इंड्यूस दिस जनरल एनेस्थेसिया, then main anesthetic, the dose of main anesthetic will be decreased, and by using these pre-anesthetic drug. So this is known as dose sparing effect. In the same way, anesthetic effect, sedative effect is noticed. Suppose if you are infusing IV local anesthetics, then what will happen? Anesthetic dose of main drug will be decreased. So this is known as anesthetic sparing effect, also known as dose sparing effect. Is sometimes used in as a anti-arrhythmic drug, and this also have GI pro-motility effects. It's also used for the treatment of shock, and sometimes it can induce this hypotension when given in intravenous route, given by intravenous routes. This is metabolized in liver and can be infused IVs continuously with inhalant anesthesia to augment analgesia. Means if you are using inhalant anesthesia just for the maintenance of general anesthesia, at that time also you can use these local anesthetics to achieve analgesia. This is another drugs, mepivacaine, bupivacaine, and topical anesthetic. Most commonly, cream is available for this ophthalmic use. This most common drug is proparacaine, which is used for to achieve topical anesthesia in case of eye. Suppose you are interested for a ophthalmic examination, then this proparacaine is most commonly used local anesthetics, and these are different creams of lidocaine and relocaine is available in market. So all local anesthetics are local and occasionally systemic vasodilator, except cocaine. Cocaine causes vasoconstriction. All drugs, local anesthetic drugs, causes this vasodilation, except cocaine, which is used for, which is having effect like vasoconstriction. Sometimes toxicity of local anesthetic is also noticed, and these toxicity include seizures, hypotension, arrhythmia, apnea, methemoglobinemia, which is most commonly seen in case of benzocaine and prilocaine. Sometimes allergic reaction is also noticed. These are the common toxicity of these local anesthetics. Now, next one is, which is very important topic, is for especially for field condition, even for you people also, local anesthetics technique. So local anesthesia for standing laparotomy. Standing laparotomy most commonly for if you are interested for this rheumatommy, secotomy, and another many cesarean section, ovariectomy, liver or kidney biopsy, intestinal obstruction. Then for these type of surgery, you need standing laparotomy, and standing laparotomy can be done by following these technique, and this can be followed by infiltration anesthesia. Next is another one is proximal paravertebral anesthesia, distal paravertebral anesthesia, and segmental dorsal lumbar epidural anesthesia. These are the techniques which can be used for these operations like the rheumatommy and all these written here. So first I will discuss about infiltration anesthesia. What do you mean by infiltration? Means you are going to infiltrate local anesthetic over the line of incision. सपोज करिए आपको सीजेरियन के लिए एक यहाँ इंसिजन देना है, then you are going to infiltrate local anesthetic over that particular line. This is also known as line block. The advantage of this is it is very easiest technique, and the most commonly needle size used is 20 gauge. So mostly we used to infiltrate these local anesthetics in muscle layer and peritoneum. Don't enter inside, otherwise what will happen? It will penetrate internal organs. So try to avoid these inserting the needle beyond the peritoneum. So try to include muscles layer and peritoneum so that we can get good line block and good infiltration anesthesia. Disadvantages, large volume of anesthetic is required. Definitely, if you are going to infiltrate local anesthetics in a line, then definitely large volume of anesthesia is required. And another disadvantage is muscle relaxation, which is very much required for the surgical operation surgery is not properly noticed. Means lack of muscle relaxation will be there. And next one is incomplete block of deeper layers of abdominal wall. Means definitely you will have precaution that needle will not go beyond the peritoneum. So definitely blocking of this deeper layer will not be achieved. Formation of hematoma along the incision line. Sometimes if you are going to insert needle, then definitely sometimes bleeding will be noticed and hematoma sometimes is noticed over that particular line. Increased cost due to larger amount of anesthetic used and time required. Complications, already I have discussed. Toxicity of lignocaine is there. So this is 250 ml or 5 gram administered intraperitoneally to 450 gram cow or 10 ml 200 mg to adult goat. This is the safest amount which can be used. If you are going beyond this, then definitely toxicity will be noticed. Now you see this inverted L block. Inverted L block. You see this line is there. You see here. This is inverted L sept. So this technique is known as inverted L block. So if you are going to block this nerve, means you are going to block all these nerve, then you will have analgesia and desensitization of these part. And this is the part where you are going to give incision for cesarean section. Even for if you are going for this laparotomy, rheminotomy, then this is the site for rheminotomy. Means by achieving this inverted L block, this is infiltration anesthesia. You are going to infiltrate the lignocaine towards this line, inverted L sept. So that's why this is known as inverted L block. Inverted L block is a line along the caudal border of last rib. This is last rib. So you are going to have this line, this infiltration line, caudal border of this last rib, and a line ventral to lumbar transverse process. You see here, this is lumbar transverse process. So you are going to infiltrate in this way and in this way. So this is the site of transverse from the last rib to fourth lumbar vertebra. This is the site. So this is the method of this inverted L block. Method: inject drug into the tissue bordering the dorsocaudal aspect of the last rib and ventrolateral aspect of the lumbar transverse process. Already I have discussed, creating a wall of anesthetic enclosing the incision. Okay, so this is known as inverted L block. Now next one is, this is specific nerve anesthesia, in which you are going to desensitize a particular branch of the drug. This is known as, first one is proximal paravertebral nerve block. Proximal paravertebral nerve block. This is a paravertebral nerve block. So first I am going to discuss about proximal paravertebral nerve block. Then I will discuss about distal paravertebral nerve block. So proximal paravertebral nerve block is also known as Farquharson Hall or Cambridge technique. This is the name of scientist. So in which we are going to desensitize dorsal and ventral branch of T13, L1 and L2. And by having this technique, you are going to have analgesia of the caudal most part of paralumbar fossa. Paralumbar fossa is here, just caudal border of last rib. For cesarean section, even you will get some desensitization or analgesia of 4 teeth and mammary gland. 4/4 of the mammary gland also desensitized by using this proximal paravertebral nerve block. So कैसे करेंगे आप? Now question come. This is part of practical, but you should know these things. It is very important for you people. Palpate the lumbar transverse process. पहले lumbar transverse process आप palpate करिए. From L5 you go forward to L1. L1 will be difficult to feel because of having a very heavy muscles mass. So L1 cannot be filled. Anyway, but for the just to assess exact location of L1, you just palpate midline and 5 centimeter you come towards yourself, 5 centimeter, and palpate. That is the point of this L1 lumbar dorsal process. And the important thing in this proximal paravertebral nerve block is insertion of site should be 90-degree angle to the spaces between the dorsal process. T13 L1 है ये, T13 L1 है, and आप इंजेक्ट ऊपर से करेंगे यहाँ 90 डिग्री पे, यानी वर्टिकल. ऐसे आप 90 डिग्री पे डालेंगे नीडल. Then what will happen? आप नीडल अगर डालेंगे मसल्स को इंसर्ट करते हुए, it will go down vertically until it will hit this transverse process. Cranial edge of this transverse, उस पे hit करेगा and proceed downward. थोड़ा सा इधर करिए और उसको downward then करिए उसको. Then it will reach to intertransverse ligament is there. Just below the transverse process, you will get this intertransverse ligament and inject at least 10 to 15 ml of 2% lidocaine below the ligament to block the ventral branch of the nerve. So this is all about this proximal paravertebral nerve block. Then we will discuss advantage and disadvantage written over there. I will give you notes. No, don't worry. After finishing this regional and local anesthesia. So advantage: anesthesia of skin, musculature, and peritoneum. Wide and uniform area of analgesia and muscle relaxation. No additional restraint is required because you are going to block a specific nerve. That's why here you will get muscle relaxation. Otherwise, in case of local infiltration, you are not going to block any nerve. That's why you will not get muscle relaxation there. But here, in this case, you are going to block a nerve of that particular region. That's why you will get some muscle relaxation. Large quantity of local anesthetic not required because 10 to 15 ml is required here. You are going to block a specific nerve. You are not going to infiltrate these local anesthetic duct towards a larger area. Disadvantages: produce difficult in fat animals, fat cattle, and some beef cattle. जिसमें ज़्यादा muscles है, it is sometimes it becomes difficult to palpate this lumbar transverse process of the lumbar vertebrae. So sometimes it is difficult. Arching of spine caused by paralysis of back muscles. Sometimes faulty injection leads to paralysis of back muscles. And in this case, no anesthesia abdominal viscera. हमको visceral organ का anesthesia नहीं मिलेगा इसमें. ये disadvantages है इस technique का. Bowing out towards the area of incision, making the closure of incision more difficult. जिधर आप देंगे anesthesia उधर थोड़ा animal will be down. क्योंकि analgesia होगा उसको तो उधर side में थोड़ा उसका हो जाएगा. इसलिए वहाँ उस area में incision, closing of incision sometimes become difficult. Complications possible: penetration of aorta. Aorta is passing just behind this, between this, below this transverse process. So sometimes possibility that you are going to penetrate this aorta and bleeding is there. So precautions should be taken just to avoid this penetration of aorta. Possible penetration of thoracic longitudinal vein or vena cava. This is just adjacent to this abdominal aorta. So these are the some complications you may notice while giving this paravertebral nerve block. Loss of motor control of the pelvic limb caused by caudal migration of the drug. Sometimes what happens if you are going to inject more drugs, then it will move towards caudal side. Then hind limb limping or hind limb analgesia is also noticed, and this is the common complications. So don't try to be panic by having this type, if you are having this type of analgesia. Now this is distal paravertebral nerve block, in which dorsal and ventral rami of T13, L1 and L2 nerve block. This is dorsal. Now you see here angle of penetration. In proximal paravertebral nerve block, angle of penetration was 90 degree to the transverse process. But here inserts the needle ventral to the tips of respective transverse process. L1 ऐसे आएगा ना, L1 L2 का transverse process ऐसे आएगा. तो just इसके नीचे, just try to insert needle towards the ventral of this lumbar transverse process. Exact anesthetics 15 to 20 ml in fan-shaped manner. Means if you are going to insert needle like this, then you have to infiltrate like this, fan-shaped manner, so that it will cover all the tissue below this transverse process. Then withdraw the needle for short distance, then reinsert it dorsal and caudal to the transverse process. Then what? ऐसे करके उसके बाद थोड़ा needle खींचना है ऊपर, उसके बाद towards ऊपर जाइए, towards ऊपर, इस transverse process के थोड़ा सा ऊपर जाइए, then you deposit this local anesthetic towards the dorsal side. Then only you will get this distal paravertebral nerve block. So this is the paravertebral and distal paravertebral nerve block. Advantages: used for routinely size minimize risk of penetrating on major vessels, lack of scoliosis, minimal ataxia or weakness in the pelvic lip, इसमें नहीं caudal movement होता है. Disadvantages: larger volume of anesthetic is required, variation in efficacy, particularly if nerves follow a variable autonomic pathway. These are the simple disadvantages. Next one is segmental dorsal-lumbar epidural block. This is known as Arthur block. Sometimes you insert the spinal needle 8 to 12 centimeter ventral and cranial at the angle of 10 to 15 degree. 10 to 15 degree from the vertical. Means you are going to insert needle inside this lumbar element. Suppose you are going to insert needle in between L1 and L2, L2 and L3, simple in horizontal vertical direction. Then this is known as segmental dorsal lumbar epidural block. Advantage and disadvantage is written here. It is almost same to all this. This is segmental nerve blocks. You see here L1 and you are going to insert needle in between L1 and L2. So this is the segmental dorsal lumbar nerve block. Now, anesthesia for obstetric procedure and rectal tenesmus. Sometimes obstetric surgery is required. जैसे फीटोटोमी हम करते हैं, फीटस को काट के निकालते हैं, या कुछ रेक्टल टेनिस्मस है, कुछ रेक्टल या वेजाइना में कुछ ग्रोथ है, इस तरह की हम सिंपल अगर स्टैंडिंग पोजीशन में करना चाहते हैं, तो दिस इज ए टाइप ऑफ पोस्टीरियर एपिड्यूरल एनेस्थेसिया. I will discuss it later, so you will understand. Then only you are going to insert needle in between cox1 and cox2, yani coccygeal 1 and coccygeal 2. This is a type of posterior epidural anesthesia. When I will discuss epidural anesthesia is anterior epidural and posterior epidural. So this is same for the just like distal epidural anesthesia. So you are in for any this obstetric procedure and rectal tenesmus, if you are going to do any type of have this any type of minor surgery like rectum and vagina, then you are going to insert needle in between this cox1, coccygeal 1 and coccygeal 2 and deposit 10 ml, 5 to 10 ml lignocaine over there. Then you will get a good relaxation of this. You will see a relaxation of tail बिल्कुल relax हो जाएगा, और you can do minor surgical intervention or surgical obstetric procedure and rectal tenesmus. This is all about today. सुंदिता, आप कोई एक अटेंडेंस लेके मुझे भेज दीजिए. Any question, please ask.